Dr. Gray, what happens when changes in diet and lifestyle don't eliminate symptoms completely? Is there anything else you can recommend?
Although the symptoms in irritable bowel syndrome are often very variable and will change, most sufferers will identify that their symptoms are predominantly diarrhea related, predominantly constipation related, or predominantly pain, gas, and bloating. I often direct the therapy at the predominant symptom. If the diarrhea is a predominant symptom, I tend to use fiber as my first choice of therapy, recognizing that fiber is a thickener. It's very much like putting flour in your gravy to thicken it up. I use that as a way of thickening the stool and making the bowel muscles have a much more consistent stool to deal with. If constipation is a predominant symptom, I again use fiber. In this case, we use the fiber as a bulking agent to try to soften the stool and to try to make the muscles of the bowel have an easier way of working the stool. Your main symptom may be abdominal pain with gas and bloating. My approach to this situation is to try to recognize that the bowel muscles are in an irregular rhythm and they require smoothing out or balancing a little bit. Fiber can help this, and using a progressive amount of fiber is often a good way to manage the symptoms. However, you may find that you do better by using something in the form of an antispasmodic, and there are a number of those that can be used from time to time as your symptoms occur.